pepper sprays, tear gas, stun gun, and tasers. Ito ang mga karaniwang weapons ng mga girls against street attackers. But do you know that an umbrella, handbag, hairbrush, powder, foundation, mirror, and even hand sanitizer can be used as weapons? Possible yan if you know your Filipino martial art. Okay guys, we are here today with Master Oka Molina. Hello, how are you doing?
Great, how are you?
Okay, so basically what is FMA?
Well, FMA is what we all know as Filipino martial arts. Filipino martial arts is the indigenous martial arts of the Philippines. And it has been here since before the Spanish came in the country.
Wow, really?
Actually, we have here all the different kinds of weapons. First, we have the impact weapons. We have the karambit. This is a very small but very fast weapon to perform. Okay, we have the sanggot. It's slightly larger than the karambit. You can put it in and pull the rib cage out. Of course, we have what we know.
Is that a real sword?
This is what we call the kampilan. This is a sword which Lapu-Lapu used in defending the country against Magellan.
So I heard that you use these in movies as well.
Yes, actually the trend in Hollywood today is most films made in Hollywood is Filipino martial arts. In fact, if you've seen the movie The Bourne Identity, if you've seen 300, if you've seen Ultraviolet, if you've seen Mission Impossible, these are all Filipino martial arts. And this is something we could really be proud of.
Yeah. Okay, so paano naman, di ba, movies, paano naman yung mga simpleng tao katulad ko, di ba, estudyante ako? What if I don't have weapons like this? So how can I defend myself kung nga rin may attacker ako?
Okay, so let's talk about plexuses. Now, plexuses are nerve branches within your body. So this is a conglomeration of nerve bundles here, wherein if you attack, even with a simple brush, you could stun your assailant for a couple of minutes. So we have what we call the brachial plexus. It's a conglomeration of nerves which supply sensation and motor to your arm. If you hit him in the brachial plexus, bang, he will not be able to move his arm for a couple of minutes.
Wow.
And that would give you time to escape. The trachea is a tube which prevents breathing to the body, the breathing apparatus. So the nasal bone, in your nose, you have a nasal bone. So if you push it upward, we have the frontal lobe of the brain. So once you push the bone, it hits the brain, immediately it would cause death.
Oh my gosh.
Of course, you have the groin area. You could also dismantle his knee joint.
How do you do that?
By kicking him there, you could use this, and you could use other weapons. So maybe we could proceed now.
Okay.
I'll show you how to use the weapons. Let's start with the cell phone. So in case it comes to a point where you have to defend yourself, and you're face-to-face with an attacker, you think of the trachea. Okay, you think of attacking him in the trachea through your cell phone. So you could go like this. Bam! You could use this to hit the nasal bone. Let's proceed to abanico. We always hold the stick when there's an excess space at the bottom. We call this the puño.
Puño.
Yeah. Now the good thing about the puño is it could be used in anchoring an arm of an assailant, but it's kinda difficult at first. But once you get it, a simple abanico, excuse me, if I'm hurting you, could be used. You could bring it up and then you can attack. Pam, pam. Pam.
Wow, combo!
Let's proceed to a bladed weapon. You have a bladed weapon in your bag most of the time.
The pen.
It's a pen.
Okay. Ganun din.
Same principle.
I can like stick a hole in your throat.
Yes, you can. Okay, practice the basics again.
Okay.
Here. You could stab here.
And then here.
Brachial plexus.
It's right here, right?
Yeah, here. Brachial plexus, solar plexus.
Ah, that's right.
Yeah. Okay, so we have the bag, which is very similar to what we know as the chako in the Philippines. So the best thing you could do is probably knock an assailant out. So you hit here with the bag, pang. You could follow up here, pang. You get it in the groin, pang. So you have, so you have 3. Now this is very dangerous because the laminated tip could be really sharp.
Yeah.
Sometimes you would see a couple of Hollywood movies where they could actually severe the carotid artery here. You could do that. And of course, you could use it for strangulation. Of course, again, I'm not recommending this, but in times when you have to defend yourself, anything as simple as an ID could be used. The projectile weapons, which we call, are the most dangerous. Why? Because an assailant at a very far distance, it could be used to attack. The same thing with the powder. Using your powder, putting it on. You can do that to disable. So the thing about the foundation is it has a mirror. A very dangerous technique is you could break the mirror.
Wow.
And use it as a bladed weapon. So in an instance where you really have to defend your life, the life of your loved ones,
yes,
you may use this.
You may use this to cut yourself and cut the opponent.
Yes.
Yay, thank you. Oh, they're all yet. Oh.